Hi, my name is Dr. Dave Marquis, and I just wanted to take a few moments on this video to discuss diabetes and what makes our practice a little bit different in our approach to treating patients who are suffering from diabetes. Diabetes has become one of the major diseases here in the United States. It's an epidemic where you find that greater than 50% of the population, due to obesity and mismanaging of their carbohydrate load primarily, have started to develop early onset at ages that, prior to 10 years ago we really didn't see. They've taken juvenile onset diabetes and they've actually created a new category where you've got type 1.5, where you're seeing kids that they were leaning towards type 1 and then they ended up developing type 2 because of some of these things that have gone wrong dietarily. Well, when we look at an individual who's suffering from diabetes, we do it both neurologically and metabolically. And that's a common approach that we take here in the office for most chronic conditions, because rarely do you find an individual where their problem is founded in just one region of the body. We are organisms that have quite an intricate build to us, and when our action is taken here, there's a reaction someplace else. And you certainly see that with diabetics, where they'll start to mismanage their blood sugar, and you'll start to notice that it's not just a matter of adding on the pounds, but they're also causing vascular damage. Some of that vascular damage then leads to neurological damage. Some of that neurological damage then progresses into endocrine problems where they have other diseases. So you see that one disorder kind of feeds off into a whole channel of other problems. So what I have people do when they come into our office is have them bring all of their labs so that we can look at their history and kind of see what went wrong along the way. And if there's any gaps in their blood lab, well, we'll order that at that time so that we can kind of catch up the chart, so to speak, and figure out in terms of their body's metabolic disorder, do they have other things that are going wrong because of their mismanagement of these sugars. For example, oftentimes you find that as your blood sugar starts to elevate and your insulin starts to chase that, and those receptors start to get denatured because of the chronic bombardment of the insulin and sugar, well, then they start to develop higher cortisol levels because they're sleeping poorly. These elevated carbohydrates at night causes elevated glucose at night in your bloodstream, and these people, once that stuff finally gets taken care of, either through getting pushed into the cell or converted into fats via the liver, then you start to go hypoglycemic, and these folks will commonly wake up at 3 to 4 in the morning. They'll have disturbed sleep. As their sleep pattern gets disrupted, their cortisol pattern, that's the hormone that your adrenal glands are supposed to be producing at very specific times at very specific levels that allow you to sleep at night and have you energetic in the morning, so that you have that energy curve. Well, you'll find that as your insulin receptors get damaged and the adrenal glands start to get fatigued and your liver gets overworked and starting to produce more of that fat and your body's now storing it centrally, that's when people start to say, well, I need to make some changes. And so they'll go into their doctor, and their doctor will order some of the standardized blood lab, and they'll say, yeah, you know what, your blood sugar is a little bit high. Why don't you cut back on those carbs a little bit? Well, there's other things that you want to look at, like your fasting glucose, for example. The ranges that are acceptable sometimes I think are absurd. I'll look at these ranges, and they seem to be getting more broad as time goes on. Another one that becomes more broad is your your hemoglobin A1C. Hemoglobin A1C is a way to look at your blood glucose over a 3-month period of time. When I got out of school, the acceptable level was 6.0. Now, a lot of the labs in our area are still using that number, but I've had blood work come in from other regions of the country where they've pushed it up as high as 7.0. And what that means is that because more people are being diagnosed with the disease, the range has broadened out as to what is acceptable. Well, if your blood glucose is sitting above 100 and your hemoglobin A1C is sitting above a 5.9, you're a diabetic, and your body is not metabolizing sugars appropriately. So in addition to the blood lab, you want to get some saliva labs. so that you can actually see what's going on with your cortisol and your insulin, see if you're managing it appropriately. Because there's a lot that you can do to change that and correct what's going wrong with your endocrine system. We would look at your food antibodies to see what can your body really metabolize and what would be the optimal diet for you. And if there's been damage done to other tissues, and invariably there is, because as your sugar rises and as your cortisol rises, your brain, your nerves actually begin to fry. And that's when people start to have foggy brain, or they have difficulty remembering name and number, or they start to notice neuropathies, different sensories in their extremities that they didn't have previously. That's when you got to put on the brakes and say, you know, I need to make some life changes. Well, here in our office, as we evaluate an individual and find out what's gone wrong metabolically, and then also evaluate what's gone wrong neurologically, then we can implement a comprehensive treatment protocol. Identifying what a person can and should eat, present them with that diet, and educate you as to the foods that would be safe for you. And I'm not just talking carbohydrates, fats, and proteins. I'm actually talking about the foods that might be driving an autoimmune process that could be attacking your pancreatic islet cells that are producing insulin. Many people are eating things that they simply cannot metabolize. You'd be surprised at how many diabetics are in that gluten and gliadin sensitive group, where anytime that they eat those things that are wheat, oat, barley, rye, or spelt, those foods trigger an antibody release, and those antibodies not only attack those foods, but they also attack the pancreatic islet cells, and it's just killing them off. And so when you pull those foods out, you can actually save that organ. And then you can start to restore function of that organ by using many of the compounds like Gymnema sylvestre. I won't go into all the details of the things that you can use, but just know that if you stop the attack, manage the sugar load, feed the body with the things that it should be metabolizing, then you can go in to repair those things that became dysfunctional, using oxygen to feed the brain and the nerves, using vibration therapy, using laser therapy for regions where it might have been damaged severely, using oxygen therapies. There's so many things that can be done to repair a body after it's gone through a long period of inflammation. I encourage you to give our office a call if you're suffering with diabetes, and the ladies at the front desk will take your information and they'll answer many of the questions that you have. Bring in all of your lab work that you've compiled up to this point so that you and I can sit down together and create a timeline and say, okay, well, here's where you went wrong. And if there's gaps in that puzzle, we'll order that lab so that we can fill in those pieces. And then as we put together the picture of how to get you better, then we'll walk down that road and implement those therapies so that you can get back to the lifestyle that you originally saw yourself living. I thank you for taking the time to watch this, and I wish you the best of health.